Yes, welcome to this digital video event with BioPorto. The new management in BioPorto is here with us today to discuss the future of the company, how they see it. So it will be very interesting for us to hear about that. My name is Henrik Ekman, and I'm an equity analyst here at HC Andersen Capital. And with me today from BioPorto, as said, the new management team, CEO Anthony Perret, and CFO Neil Goldman. A warm welcome to the both of you.
Thank you.
Thank you very much, Henrik.
It's great to be here.
And perhaps we could start out by hear your sort of your overall thoughts about BioPorto, where you see the opportunities and perhaps even the challenges for the company as where it is today. Tony, perhaps you could start.
Sure. I mean, the biggest opportunity that we have is to get the NGAL test. This is the test for diagnosing acute kidney injury to the market in the U.S. Right now, we do have a CE mark on the product, and we sell it on a worldwide basis. With the exception of the U.S., we need an FDA right to market in the U.S. To get it on the market and being used by clinicians, specifically ordered by nephrologists and intensivists in the ICU. But to do that, we need the FDA clearance to market. Going into the challenges that the company has had in the past is they've made multiple attempts to actually get that FDA clearance. But I can largely characterize that as submissions that were done without FDA guidance. This time around, we have a high level of confidence because this is an FDA guided submission, so to speak. So there have been multiple meetings with the FDA on what exactly they need in terms of data and the protocol for the trials to get it cleared. So once that clearance happens, then we can market to the clinical community and establish that beachhead. Now, this first clearance will be for pediatrics, and that'll be our area of focus before we expand into the adult population. So, the other challenges associated with what I found anyways with the company is that level of focus and clarity within the organization, right? We cannot be all things to all people. So let's focus on this beachhead first, and then we can basically bring in other actionable biomarkers surrounding the kidney area, the critical care area, I should say, in the future.
Okay, and perhaps Neil, anything to add?
I guess what I would share, building a bit on what Tony said, is I spent a fair amount of time looking at the company before I had the opportunity to join it. And one of the things that became very apparent to me was the level of talent, both at the management, at the board level, that had come into the company, that Tony's predecessor, Peter Eriksson, had brought in, that to move the company and take it to the next level. And it's really the team that Tony described that I think has the talent and the experience in working with the US FDA on an interactive basis with the breakthrough designation that team has been able to achieve from the FDA to use that in the clinical design. And that's certainly what we're very focused on.
Okay, so what we should expect as you are in dialogue with FDA, you also, I guess, at a parallel level is building the organization in US and to be prepared for this hopefully approval of the NGAL test.
That's exactly right. What's incumbent on us is actually to message to the clinical community the clinical value of the test, right? So we're not only selling into the clinical lab or the chemistry lab in hospitals, but we have to basically market to the intensivists, the nephrologists within the hospital, the value of the test, and hence we'll need to build an organization to deliver that.
That's right, and importantly, Henrik, that's not just in the U.S. While certainly that is a commercial focus, we do have sales around the world and a commercial attention with our customers around the world. The NGAL test, as you know, is approved through a CE mark in Europe and elsewhere where that's accepted, as well as our biomarkers that make a difference for researchers and clinicians every day. But as it relates to building out the organization, if there's any common thread that I look at back at what I've done over the years, it's about scaling organizations and enabling them to be ready for and to deal with growth. And that is something that applies across our global footprint, and we look forward to doing as our success hopefully comes along.
And that, I guess, is also has to do with building a culture that is agreed upon in the whole organization. What sort of the challenges there as you actually are located in different places in the world? Yourself is in New York, Tony is in Boston, and some of the organizations in Denmark. What sort of the approach to building global culture? What are they?
Yeah, so what's interesting is we're currently in a strategic planning exercise, right? And we're doing this remotely with basically the leadership from around the world. And so we view ourselves not as a US company or a Danish company, but as a global company. And I think that's absolutely key as we build our plans. And to assimilate the cultures. Let's face it, we all come from, different countries, but by working together literally on a daily basis, the goal here is to establish this team approach, this team culture that is not siloed, across country boundaries.
Yeah, and Tony's absolutely right, and the great thing that I've seen through these interactions that he's described over the last several weeks since we started with the company has been an absolute commitment across the board from our colleagues that we've got one team, we've got very clear objectives. Everyone is incredibly passionate around the things that Tony described as being what are our strategic objectives. And the way to do that is to stand shoulder to shoulder and run through walls. And I think everyone's excited to go do that.
So if you were to, and I guess it goes without saying that the NGAL test approval is, of course, of major importance to you as a team and for the company as a whole. But would that be the absolute key priority and the key objective for us as investors to evaluate you as a management team? Would that be that particular approval, or what should we expect?
Yeah, that's the initial focus, right? Is getting that particular clearance, as well as growing the NGAL test around the world. But we need to continue to have a pipeline of products come in after the NGAL test, right? So we will continue to invest in discovery, in feasibility testing on other actionable biomarkers that come in after. What's key here is we provide some level of focus now, but also have a pipeline of development coming in after.
That's right. It's built on a recognition of building that pipeline, but also recognizing that the NGAL test, of the many studies that have been performed on that biomarker by clinicians around the world, is that there are opportunities to leverage that in clinical areas beyond our initial focus of pediatric acute kidney injury. And that certainly represents one dimension of the growth path that the company has ahead of it.
Okay. Today BioPorto, it has a number of businesses. It sells the ELISA test kits. It produces and sells antibodies and has a GRAD technology platform, and of course is hoping for the NGAL test kit to be approved. So that's a lot of product offerings from a small company like BioPorto. Should we expect any sort of change focus in that, or what's your thoughts on that?
No, there's definitely a lot of overlap between what we are already doing in terms of antibodies and ELISA, and the GRAD test, right? So we need GRAD for our own test development. It's definitely a platform that we're looking to commercialize in the future. Antibodies and ELISA right now provide a revenue stream that we count on. And like I said, there's a lot of overlap between what we're doing for to produce those products as well as the NGAL products.
Yeah. And Neil, as Tony was saying, there's actually a revenue stream coming from the antibody and ELISA test kit business. So as you are in charge of the financials, what are your thoughts on the financials in BioPorto, and perhaps also a few thoughts on what has been discussed earlier on a possible US listing? Just your thoughts on that.
Yeah, well, I guess first of all, I don't want to get too far ahead of us. We're on week 3 or 4, and there's a lot of things we still need to think about, talk about, and evaluate together with the management team and with the board. That said, I give the company a great deal of credit for having built the customer relationships, the clinical relationships, the distribution relationships that enable that, as you described, a diversified revenue stream that have call points that are like the ELISAs, for example, that you referenced and as Tony described, that are comparable and complementary call points for the customer and provide a basis upon which to grow customer relationships over time as we have more things that we're able to sell, including, for example, the NGAL test following an approval in the US.
Okay. Well, gentlemen, it's been nice talking to you and hear your thoughts about BioPorto, and I'm sure that a lot of investors will be looking forward to hear a lot more from you as we go along, as you as we will enter the next year. So with that, thank you very much, both of you, and we will talk to you soon. Thank you.
Thank you, Henrik.
Thank you very much.